And today we're going to be talking about the difference between MD, DO, and Caribbean medical school.
Which is the only way that you can practice medicine in the United States. So these schools have a very high attrition rate, which just means dropout rate.
All doctors can be good doctors.
While this type of physician is less common, they make up about 11% of current practicing physicians. Hi!
Hello!
I'm Simone.
And I'm Jaden.
And we are
Healers
Healers with
with You.
You. Hi, friends.
Hello.
How are we? So our goal today is to give you all the information that you need to choose the best path for you.
Before we go into the difference between the three types of medical schools,
all doctors are licensed physicians who are able to
diagnose, treat, and prescribe medications.
So something important to note is that there are a lot of ways to become a doctor. If your dream is to be a physician one day, there are many paths to that. And today we are going to be talking about 3 of them.
All right. So the first path we're going to be talking about is the MD, or the Doctor of Allopathic Medicine.
This is the path that most doctors take. 90% of all physicians are MD doctors.
But this is a very competitive path with only 40% of applicants making it in each year, and a relatively high MCAT, and average GPA for these schools is 3.74 and a science GPA of 3.67 with the average medical college admissions test score, or MCAT, of 511.
MD schools also take the USMLE Step 1 and Step 2, which are the required licensing exams to match into US residency programs. 92% of med students who are in MD schools pass their USMLE Step 1 on the first try. Another important thing to note is that 90% of the students that go through the MD programs match into residency programs, which is the only way that you can practice medicine in the United States.
MD schools also have really high success rates, with 96% of students each year making it to graduation.
That means only 4% actually drop out and don't make it to graduation. That's pretty good odds.
Now we're going to be talking about DO schools, or Doctors of Osteopathic Medicine. Osteopathic Manipulative Medicine, or OMM, is the main difference between DO and MDs. They have, while going through their 4 years matriculating through, OMM focus on hands-on treatment practices by manipulating the muscles, joints, and bones of their patients to aid in addition to traditional Western medicine.
While this type of physician is less common, they make up about 11% of current practicing physicians, and this number has increased by 30% in the past 5 years. And that is likely due to it being a little less competitive in the metrics and less competitive in the admissions process.
The average GPA for the acceptance of DO schools is a 3.61, and the average MCAT is a 504. There are 41 accredited DO schools, and in their first 2 years, the biggest difference between DO schools and MD schools, DO schools, when they have their first 2 year preclinical years, they also have 300 to 500 hours of training on osteopathic manipulative medicine. Like most MD programs, these programs start for the 2 year preclinical period, but additionally, they'll have 300 to 500 hours of their OMM, their osteopathic manipulative medicine.
Next, we're going to talk a little bit about exams. Similar to MD schools, the MCAT is required. However, once you're in medical school, the exams look a little bit different. The licensing exam for DO schools include the COMLEX, which is the Comprehensive Osteopathic Medical Licensing Exam. They also have to take the USMLE Step 1 and Step 2. However, their pass rate of the USMLE Step 1 is a little bit lower than the MD schools. They have an 82% pass rate on the first try.
The main disadvantages of DO schools include that there is a negative stigma against DO doctors, but all doctors can be good doctors. Attending a DO school can make it harder to match into a specific residency programs, and some of the OMM practices aren't scientifically backed.
Now we're going to talk about a couple of the things that would make a DO school a good fit for you. So if your test scores or your GPA might be a little bit on the lower side, this might be a better fit for you because it's a little less competitive. If you are very interested in primary care, or that that's where you want to go, a DO school might be a good option for you, but keep in mind that 50% of medical students that enter medical school end up changing their desired specialty. Another thing, if you're really interested in osteopathic manipulative medicine, this is another great place. This is where you learn it. So next we're going to talk about
Caribbean medical school.
Caribbean medical schools. So these are still MD programs. So if you graduate from a Caribbean medical school, you'll be an MD. However, there are a few drawbacks. While it does sound nice to be in the Caribbean and hang out on the beach,
you're only in the Caribbean for the first 2 years, and then they usually spend their like clerkship hours in the U.S. going to U.S. hospitals.
These are less competitive than your traditional MD programs in the US, and they're also less competitive than DO schools. They have an average MCAT of 490 to 500 and an average GPA of about 3.3.
Caribbean students have a 70% pass rate for their USMLE Step 1 and a 50% match rate when it comes to the US match.
So these schools have a very high attrition rate, which just means dropout rate, which ranges anywhere from 10 to 50%. They also are mostly for-profit schools, which means that they have a very high tuition, most of them exceeding the prices of US MD schools.
And that's all we have for today. Thank you for joining us on this video, talking about the differences between MD, DO, and Caribbean medical schools. And hopefully you can find the right path for you, which will be different for everybody depending on your own academic and professional goals and your individual profile.
Yes, and that's all we have today. Please feel free to like, comment, and subscribe down below. Ask us if you have any questions about these programs or anything pertaining the med school process. We will gladly answer those. Thank you, and we'll see you next time.
Bye.
Then are they gonna talk back? Like, what am I doing?